Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I wanted to talk to you some this morning about these bonded blocks. They have such a wonderful way of helping you in many problems you run into in orthodontics. One of the main things, they help you control the height of the lower third of the face, or the length of it in your. If you have somebody that's got a deep bite and yet they've got an open bite skeletally, you bond blocks on there back in the back, kind of like I'm going to show you how to do those today, and also just how we take them off and make them. And let's go through this, and I'll do this as fast as I can. But this is something you really use in many situations in orthodontics. So let's look at the first thing out here. We've got, just looking straight at a model now that we've made the bonded blocks on. See, they're going to be on the side, and they'll be in the posterior part out here, and that allows you to have the person chew just like they normally do. Like when we first put these in on somebody, we have them practice closing their mouth where they're relaxed, and most people close and they'll hit up here, and then if they bite hard, the bite will go back. In other words, they'll have a distal slide, and that's where sometimes you put too much pressure on that retrodiscal tissue and you have TMJ problems, and so they bite on the front teeth out here more doing that. These blocks, you want them to fit where the teeth come together. And the teeth, if you lower your head down like this, your jaw goes out to the front some. If you bring it back like this, it goes back to the back. So if you're taking any kind of bite and you want it to hit where the person uses it most, and that's where we try to get this. You just have them sit with a head-shoulder relationship like you want it. Let's go ahead and look at the sides of these. Now we can make them shorter than this. You don't have to have them that long, and you just make them right on top of the teeth, and you'll trim them down. I'll show you how we go through this. And you just make them out of plain lab acrylic. Don't make them out of anything really tough, because you can't get them loose. You're going to bond them to the teeth. I've got 3 or 4 slides here, probably more than I need on showing that on both sides of the mouth. And we have opened this by about 2 or 3 millimeters in this area where these teeth were down here, and now they're up in this area. So let's go ahead and get this out. Now that's another way from the front, that's the side. Now here's what we use, this regular acrylic. You can buy it just kind of like you use it in a lab. I have this is not a good focus here, but this is a etching. Well, I take that back. This is a liquid to make this stick to the teeth better. Now let's go. Now you need a little rubber dish like this right here, and this is just acrylic, and we're going to put it in that rubber dish, and we're going to take the dropper and drop some of the liquid on it. Let me go to that. So we put the acrylic powder in the little dish, and now we take the dropper over here, and we're going to drop liquid in this area right here. So this is the etching, well, I'll take it back. This is the etching agent right here, and you can have any kind of etching agent you want, just so it's an acid that etches the teeth properly. and we'll put that on the teeth. You put some of that on a cotton sponge, and now we'll etch the teeth down in here. The occlusal surface of the teeth, and you can etch all of this in here, and if you want to get it however long you want the block. And we etch that, and then you'll wash and dry the area out. And you go ahead and just etch it, wash and dry it. Now you take a little bit of this acrylic that you put on a brush, and we dry this out real good now. And we're going to take the acrylic, and you put just a little bit on the end of a brush like this, and go in and put that on your teeth. Put it down in here where you've got this, and put a little bit of the liquid in there to soften this up and have it attached down in the groove of the teeth. Now this is just regular old acrylic that you use in the lab all the time. So we put that on the teeth. Now you go over and you wet this part down here, and you let it sit for a little bit, and now you're going to loosen it up around the edge of this deal. You just loosen it up, and you'll have it come out in just a kind of a round donut shape. You take this now and roll it out of there, and just hold it between your fingers. And we use gloves now. Back when I took this, we didn't have to do all that gloving and everything, but you're going to hold that and just mash it out flat, and just put what length you want it to be on. And you just need to have this. Now I'm going to put a little deal up here and draw this, like you got a molar tooth here, something like this. And you've got brackets on the side over here, and you just put enough of this where all you want is just on the very top of the teeth. And now you get the person's head in the position that they normally use, and let them just slightly close their upper teeth into this, and so the upper tooth would come in like that and fit down in there. Now this doesn't, you can just make it 2 or 3 millimeters thick. You don't want it too much, but back in the back. So that's how we put that on the teeth. Now let's go. We take it from here, and we'll put acrylic liquid on this part of it right here, and then where it's going to attach to the teeth. Now I'll take that and put it on the teeth, and just press this down on the teeth. Now don't get over the side. We'll tell you, you can get over the side if you want to. Cover up everything you don't want to get this acrylic in, and just push it in. Now we'll let them bite up above. They'll come down and bite into that acrylic. Now you make one on one side. Now once you bite in it, and it leaves tracks of your teeth in there, like you, and you add a bite in the position you want. Now we'll let this one harden a little bit, and then we come back and take a number 12 barred Parker and just slice the side of this off. You just take the whole side, you can go in and slice it off. And you have Vaseline on the upper teeth so they don't stick to that. They just stick to the bottom teeth. And so we take this barred Parker and go up and down, just kind of saw that and take that side of that acrylic off. Now here we've got it off like that, and you can go on this side if you want to and trim it down. You don't need anything, just right on top of the teeth. Keep it out of your brackets and everything else. And here, this is an intruding arch, you see, that we've got in this tube here. Now this is your conventional wire. It's going down like this, and it's expanding the arch, however you want to do it. And then this one is, this goes down like that. You bring it up. It's a rectangular intruding arch, or it's a round one really. And this one is a round one. And we come up here and we bring it down. And we are opening this bite, and we're pushing this one down, pushing these up to open the bite. And that's the way you open the bite. Now, this being back in the back part of the mouth, the person is going to chew tremendous amount more and press those together much more than he normally would. So the force that we've got on this wire right here, we pull it down and hook it to the teeth. It's going to elevate those teeth, and this will depress these. That's if you've got a bite that's closed like this. You want to lower these and raise these. Then you put the, and you don't want to increase this vertical part of the lower anterior face. That makes people look terrible if you give them too much vertical dimension there. It's what we call a high angle case. Now this will intrude these teeth. That's hard to explain to everybody, that you've got exactly the same amount of force going down in this area as you have going up in this anterior part of the mouth. It's far more difficult to intrude teeth than it is to extrude them. And so if you've got somebody, you want to increase the vertical height of the face in here, they've really squished down, you can just put these blocks up in the front part of the mouth, and these teeth will come together. Bottom will go up, these will go down, and you increase this distance from the nose down to under the chin like this. But you get too much of that, makes people look terrible. That's really something you have to watch. On a deep bite case, you're opening up, you want to keep the vertical dimension of this down like that. I hope you understand that. This is one reason I did this over again, is to make sure people understand how you go up and line this up. In other words, you got a deep bite case. You want to pick the lower teeth will be up inside here. You want to pick these up, and you want to go down with these. If the lower ones are too far up, you want to go and take them down. If they're okay, just put this on the top. It'll raise the top teeth up, you see. But it'll raise them up, and all the time the person is biting these teeth together, and these teeth do not come down toward one another at all. If you've got a block in here, you can intrude these teeth down here, up bottom, top, both of them, and you won't increase this dimension between the nose and the chin. And that's where you really have to watch deep bite cases like that. Now I'm going to erase that. Now, this is something that people doing orthodontics need to really understand. You can kind of lower the whole vertical dimension by putting these blocks in here and let people chew on them a little, and they will intrude these teeth right here if you don't put any force out here. And even if you're lowering teeth in the front or up here, this will not increase this dimension in here. And that's an important thing about doing that. Now let's go on to the next. Now when you get this made and you want to get, like you use it for whatever time you want to, you get thing leveled out like you want, or whatever you're doing in here. Sometimes you look and post your teeth, you rub together, you put bonding material in the anterior. Now you get through with it and you want to get it off of here. I remember I had years ago, I had an orthodontist come to the office, come to our lecture, and he wanted to know how to take them off. Now we take a barrel burr like that, and you go right down, you've got the tooth setting here, and this bonded material with a bite in here, and you just grind down in between here. And you can see through this acrylic. When you get close to the teeth, you just stop and take this burr. You can grind that out, just like this would be going over here, and you just have a trough down the middle of it. And grind it out with that barrel burr. And now you take a pair of pliers or something with, I like to use something with an edge on it, you know. You get things sort of sharp, and you just push that together right here, and one side or the other will come off. I mean, it'll loosen, and then you just take it away. Now, if you put real hot-to-do composite and make these, and they stick down here like mad, you'll have to grind that off. So don't use that, just regular acrylic, and you can bond it right in the top of the teeth, and you can remove this. You cut the groove here and push on them on the side with a pair of pliers like this, and just push it together. And now you take that same plier and come over and just squeeze this, and it'll kind of elevate one side of that, and you pull that off. And you can take these off in just a short time. And this is so handy using this material. Now here we are with this, and we've got the intruding wire right here that goes up there. We're going to bring it down, hook it up there until we level this thing out. And you can level anybody, I don't care how old they are or how, I mean, you can do it on somebody who's 90 years old if you wanted to. And you can intrude the teeth. It doesn't bury the teeth out. The bone structure kind of moves, and the teeth come down, and sometimes you intrude them into the tissue a little bit, but most of the time the bone structure stays around the tooth about like it was originally. And of course this one is the one for the bottom arch. Now, usually we use a rectangular arch to do this. It doesn't matter though, really. And these are those little tiny brackets, and this is, I use an 018 bracket, and I have them with wings on top back in this area. But the ladies that worked at the office, they like to just use this, just a little small bracket, and would stick a soft wedge in between if you were to rotate the tooth back and forth like that. And I'm not selling brackets, but that's the kind we've used on virtually everything. Now I would try different things from time to time, so you see cases with that. All right, let's see. Now that's all I've got on just these bonded blocks, but they are very useful in, like if you got a crossbite or something, a tooth like that, you can open it up. If you put them on one side of the mouth, excuse me, that went out of whack there. If you put them on one side of the mouth, I'm going to put keep, and I'll bring it back. Now, if you put them on one side of the mouth, the other teeth will move together, and that's another way of using these blocks. So I'm going to say goodbye, and I hope you learned something from this. And it is something that's very useful to learn how to do these blocks, and they help you out in a lot of situations. So we'll say goodbye, and I'll Hope you'll join our group and subscribe to our channels.